The IAR, known as the Initial Assessment and Referral Tool, is an initiative of the Department of Health and Aged Care. It's being rolled out nationally through primary health networks. The main component of the IAR is a decision support tool.
The IAR decision support tool makes it easier for GPs to navigate the huge number of mental health services within our region. It is a really easy, quick and efficient tool to use. It is designed to guide conversations with patients so that you can get a snapshot of information about their situation and their mental state.
When we think about the mental health support needs of different patients, it could range from quite simple strategies that someone might need when they're going through a bit of a tough time. We'd class that as low intensity, right up to needing some really high level services, which we'd class as high intensity services. So the good thing about this tool is it'll assist clinicians to be able to identify what level of support their patient needs at that time in a stepped care model.
The stepped care approach is a person-centred approach. It's matching the unique needs of the individual with the right amount of service intensity.
The tool generates a level of care between 1 and 5 after we enter information into 8 weighted domains, which look at the patient's history, their current situation, their symptoms, the distress they're experiencing with their symptoms, and the sort of supports they've already got in place. It is designed so that patients can be actively involved in decisions about their mental health care, and it supports a warm handover whereby we're not making the patients repeat their story over and over.
What we're looking for is making sure that the person in front of us gets the need at the right time, at the right place, with the right level of intensity.
Once the assessment has been completed and the level of care has been established, GPs can use our mental health help website to match clients based on their location, their needs and their level of care.
IAR can be a real game changer for our region. We know that so many residents have been affected by numerous natural disasters and of course, like everyone else, the COVID pandemic. So we really do have high demand. This has put a lot of pressure on health providers and on our residents. Using the IAR can help avoid over-servicing, which we know can put strain on the health system and limited resources, but it can also avoid under-servicing, which we know can lead to poor health outcomes for patients.
It's not a tool to be used alone. It's not a diagnostic tool. Of course, you're going to be using this to supplement your other clinical judgment, your other clinical assessment. Doing this training means that you can be up to date and be ahead of the game to know what's changing, what's happening in the mental health space.
I've been a mental health nurse for a number of years and I've used a lot of tools and been introduced to a lot of new tools. Most that we get given are quite often ineffectual and just a tick box type arrangement. This is a really metered and structured way to do an assessment. I didn't understand how efficient it was going to be, to be honest. GPs, clinicians and members of the public can phone and we can assist them in finding appropriate services close to home.